episode of Under Contract. I have such an amazing guest today. As always, I want to bring educational and inspiring guests to you and information to you that will help make a change in your life. And every guest that I've had on lately, it has been very relatable, not just for me, but for my audience. And the reason I've done this is because we all have gone through some sort of health crisis. And I personally have gone through multiple health crises, and they have put me in a place where I want to understand more and seek alternative ways of dealing with chronic illness or any sort of health issue that I may have had. And today's guest has done something pretty amazing, in my opinion, in the holistic and natural approach to mold sickness. I personally have experienced black mold exposure, have been chronically ill because of black mold. And there are a multitude of ways to remediate it, whether it's in your environment or in your body. But the one thing that stands out to me about this guest is he has founded a company called Microbalance name it again, Dr. Dennis, Health Products?
Health products, yeah. Microbalance.
Microbalance Health Products, and they are doing things differently, naturally and holistically, in terms of how you approach mold exposure sickness. So today, that's who I have on the show. I'm excited to deep dive with him to find out what prompted him to create this product, this company. So, Dr. Dennis, welcome.
Oh, thank you for having me.
Yeah, I'm excited to learn more about you and what prompted you to go down this rabbit hole. So, I guess the biggest question for me right now is, you're a doctor, you are a practicing or were a practicing physician. What prompted you to go down this trajectory, mold, and in the way that you have done it, holistically, naturally? Because obviously, there's other ways people would treat mold, right? But you've done it in a way that is very unconventional, but really stands out. So, what is your pain to purpose story?
Well, I started out by going to Johns Hopkins and getting a a degree in otolaryngology, which is ear, nose, and throat, basically
Mm,
surgery. So it's a surgical subspecialty. So once you get out of an institution like that, you think you know everything because you got trained by the best people on the planet. And you think everybody gets better. And so when you get in practice, you see people longer than you ever saw them when you were in training. You may see them
mm,
a month or so, and then you think everybody got well. When you're in practice, you know that's not true. So you'd operate on someone and get them totally clear, and in another month or two, they'd be sick again, full of pops and pus and everything. And you do everything, operate on antibiotics, steroids, everything you know to do, nothing works.
mm.
And so I had this one patient came in and he'd been sick forever. He came in and it didn't matter what I did, it didn't work. So he came in one day and he was totally pristine clear. I had never seen him like that. And I said, okay, what have you been doing? Because I know it's nothing I've been doing.
Mhm,
And
mhm.
so he laughed. He says, well, I went to the beach for 2 weeks, doc, and I got well. So then I knew it was environmental. And
Wow.
then I tracked it down. It was fungus, and then it went on from then. To make products that would help these people. Ultimately, you got to get the air right. So I've got this little paradigm. I say, you're breathing 3,000 gallons of air a day. So if the air is not right, it doesn't matter what treatment you're doing, it's not going to work. So it's like trying to dry off while in the shower.
Yep,
You're not going to be able to
yep.
do it. So because there's not enough towels, right?
Right.
So the towels would be the treatment. So once you get that right and you get your environmental air right, then all the treatment works because you're not overburning it with more fungus. So about 20% of the population is allergic to fungus, and some of that 20% gets chronic sinusitis, and and some of the other ones get chronic sinusitis with polyp formation. So polyps is a tissue that grows in there. It looks like little balloons everywhere, and it's just immune reaction they have to it because they have an eosinophil reaction to the fungus.
So, Dr. Dennis, how often is mold mistaken for a sinus infection?
Uh, m- mold, it's the other, never, it's the other way around. Sinus infections are rarely ever considered mold issues
Mm, mm.
in my specialty. But Mayo Clinic wrote an article in 1999, really, proving that mold was a chronic cause of chronic sinusitis. at least 93% of the cases. So basically, still, most people have no idea that polyps have to do with mold exposure, and chronic sinusitis has to do with mold exposure. So they never get the patient well long term because they never get their environment straight.
Yeah.
So it's just steroid surgery, antibiotics over and over and over, a million times.
Yeah.
So uh, if you don't get the air right, you can't get them better. So that's the bottom line.
And I had a conversation previously with a healthy home specialist, and we were talking about how, you can do all the right things, right? You can do all the protocols, you can eat well, you can drink the best water. But if your environment is not conducive to you being healthy, you will remain sick. You will be chronically ill. And I feel like that's the same situation here, especially when it comes to mold and our sinuses, right? Because I know I'm super sensitive to mold. And if I walk into a room, it will trigger me and I'll have a flare immediately. I'll have either my sinuses will bother, my eyes will bother me, my skin will start to itch. I can tell, but when I leave that environment, I feel better immediately. So absolutely, it is your environment, right? I mean, that's going to keep you sick at the end of the day. So why do you feel, Dr. Dennis, chronic sinus issues are so often treated incorrectly?
Because they don't know it's an environmental illness.
Yeah.
That,
Yeah.
that's the main reason. And so they never give them any antifungals. But if you're still in the environment and you give antifungals, they're not going to work.
Yeah.
So I think the majority of ENT people don't realize that it's an environmental illness. There's some out there that do, but not very many.
Okay.
So that's why the patients are going on a cycle of steroids, antibiotics, and surgery, over and over again.
Yeah.
There's never a question asked about the air and environmental issues, so they can't ever get them better because they don't know why they're sick.
Yeah. So you created this company, right? And you have a plethora of products from what I mean, I received my care package, and in that care package I had some wipes, I had some solution for the laundry, I had a body rinse. There's so many different products, and I feel like these products, the microbalance products that you've created help have a healthier environment. They help remediate some of the mold that might be on your counter, wash the allergens off your body, right? So what's the biggest health transformation you've seen after a patient maybe has, remediated their environment or they've used your products consistently? What's the biggest transformation you've seen?
Uh, the biggest transformation, kind of, I see really sick people. I've seen people who are in a wheelchair for 2 years walk
Wow.
uh, because they got the air straight and they got killed all the fungus in their body. They irrigate with the citrus drops and saline, and then they do citrus spray, and you can also take citrus drops orally and water, which is a good antifungal, and the,
Mhm.
and the other kinds of products that support them. But environmentally, some of them can't get the environment straight totally. So that's why we made the candles. Um, the candles in 2 hours will remove all the mycotoxins from the air in a 12 by 12 space, all of them.
Wow.
And there's never been a
Wow.
product that has proven to do that. And
Yeah.
we've got laboratory data to show that happen. So I know the patients were getting well, and I wanted to prove it was because the mycotoxins were gone, and that's what
Isn't that
happened.
something? That's crazy. So a lot of the products you have kind of mitigate all the mycotoxins in the environment.
That's right. And it's
Yeah.
just a simple candle. So if you don't, if you can't get out and do everything you need to do, the candle is the first line of defense. And then you've got the fogger. The fogger shoots out 30 feet with the EC3 products or just citrus seed extracts. I mean, you could drink it, it wouldn't hurt you. Uh,
Yeah.
and you could sit it on the floor and then fog yourself. You just mist yourself and you can mist your whole house in
Wow.
just a short time. You don't put it down. You should keep holding it. You just walk around to all the rooms and mist every room. So just that massively knocks the counts down. So
Wow.
I mean that and the candle and and then you can shampoo yourself and wash your body off, get it off your body, and then rinse your nose out. So those simple things massively reduce your fungal load, even if you're in a bad situation. So
Wow.
you can still get people massively better by just doing those simple things until they can't either get out of a place or fix their house.
So, what would you say your most effective product is for someone who doesn't have a lot of money and they can't purchase a multitude of your products? What would you say your most effective, most cost effective, and more bang for your buck, if you will, if someone's going to say, "Hey, I've got $100 to spend and I want to purchase some of your products," what would those recommendations be?
I think the first thing you got to go environmentally first.
Right.
Uh, get the candles. That's the cheapest thing you could do. Uh, and then get yourself a decent air filter. Have an air filter
Yeah.
with an ionizer on it. And then get the irrigation, just a little irrigation bottle, and put sterile water with salt in it. The little packets come with it. You just put the packet in and fill it up with distilled or bottled water, and it irrigates and add some citrus drops to that. Just rinse your nose out with that twice a day, and then
Mm.
use a citrus drop nose spray. And then you can take the if you want to go further than that, I don't know how much you spent by the time you do that, but
Yeah.
then you want to detox, which would be glutathione, NAC, and liver cleanse, which is Mycotoxins. Those are the three products get it out of your system, and the irrigation get it out of your nose and sinuses, and then the candles get it out of the air. So that's the least expensive thing you could do to start feeling better.
So, Dr. Dennis, do you feel like a clean looking home can still hide toxic mold? I mean, if we're talking about the environment, because not every consumer knows what to look for in their environment. They can feel it, right? But do you feel like a clean looking home can still hide toxic mold?
Oh, sure.
Yeah. In
It
what
can look
way?
pristine and perfect.
Yeah.
Well, you can't see mold, and sometimes you can smell it. Some people can't smell it, but the easiest way to do that is get the mold plates from Microbalance, and you can put the mold plates out for an hour all over the house, and then you can cap them and read them in about 4 days. If you've got more than four colonies, you've got a problem. Those are little spots on the plates. Each spot represents a fungal colony. So that's the first thing you can do. But also with the plates, you can do what's called a tap test, which is even faster because you can open the plate, turn the plate upside down, and just tap it on whatever you're testing,
Wow.
and then cap it and put it in a dark place and look at it every day. And about day four, you read it, and then it tells you what's going on in that space. That's the cheapest, quickest way to tell if you got a bad situation.
So is that similar to a petri dish?
Yes, but it's called SDAR or Sam David
Okay.
I Allen,
Okay.
Auger,
Yep. Yep.
and that's it's got high sugar content, so it grows fungus really better.
Okay. Wow, that tells everything right there. So so what is it about microbalance that makes it so effective? I mean you mentioned citrus. I know I've used some of the products, but what is it that makes it so effective and for the consumer who's looking for a healthy, natural, holistic way to combat mold exposure sickness? What is it about your products or your product line that makes it so effective?
I think it's because uh, we saw the patients clinically because they were really sick, and we see kind of the sickest of the sick. And if you get those people well, you get the other people well. So it was the realization that you've got to get the air clean. And so that's why we made the candles and then the fogger, and then you fog yourself. So get it clean environmentally first, and then irrigate your nose out and clean it out with antifungal sprays. Uh, that's what made us invent all this stuff because it really wasn't anything one-stop shopping place that was uh, focused on health.
Mm,
It was focused on just the house, not the person.
mm.
So you got to get both done. at the same time. So that's why this company was born to do that, uh, and validate it clinically so you know it really works. So you see in the
Right.
patient clinically, you know, well, this has really worked for these people, and that's how it was born.
So if you were to describe your company in one statement, what would it be?
Uh, Healthy living uh, in a moldy environment, you know,
Yeah.
like how to address it. You can't live in mold, but you can fix it.
Yeah. So talk a little bit, Dr. Dennis, about how mold affects your brain and your nervous system.
That's I see this every day. That's what I do every all day. You know, it, you have patients come in, and I ask them two simple questions: What's your cognition score if 10 is normal? Most of these people are below 5, and they struggle. And then what's your energy level with 10 being normal? And most of them are around 5 or so, and sometimes 2. And that group of patients have got pituitary damage. And we
Mm,
proved through artificial intelligence software now, we can see the mycotoxins in the brain, uh, which we never could do that before. So we know which medical treatments and which environmental treatments actually get it out of the brain.
wow.
So if they have positive urine for mycotoxin, they have a positive brain for mycotoxin
Mm,
100% of the time. And so that's why they have cognition defects, they have visual problems, hearing problems, smell issues, balance issues. But the most profound is cognition. And the way most of those patients end up needing sinus surgery, it's not that serious, but you have to physically clean it out. You have to open the sinus and irrigate it out with an antifungal. And then we put antifungals in there after we finish. And you have people when they wake up or a day or so later, you know, if they have time to clear their head,
right.
many I've seen people's vision come back in the recovery room, either blindness in one eye, the vision come back, or hearing come back, or balance come back, and cognition in difficult, you know, mathematical type things come back, uh, you know, after you cleaned it out. And of course, they have to have their house cleaned out too.
Of
But these are
course.
people who've done everything and not getting better. They need surgery.
Wow. So mold is such a, and there's so many people. I tend to think that women and children are more inclined to say, yes, mold is truly a thing, right? Because once somebody's infected in the home, the whole family is infected. It could be dogs, it could be, hidden, it could be easily detected, whatever it might be. But I tend to feel like men, for the most part, just have this attitude that it's just mold, right? It's just mold. Don't worry about it. Is that something you've experienced in your practice, Dr. Dennis? Or is it
Uh,
across the board?
oh yeah, well, it's not just men; it can be the other way around. Whoever is not sick does the same thing. This house is fine. I'm okay
Yeah.
because they're not sick, and so they say, "Well, it can't be the house, honey, because I'm not sick." So
Right.
that's like they're both sitting at the breakfast table eating strawberries, and she's allergic to the strawberries, breaks out in a total body rash. And the guy says,
Hmm.
"Well, it can't be the strawberries. I don't have a rash." It's the same, you know, cognition issues. So
Hmm.
you gotta be open minded and try to help each other. If somebody's sick, they're sick for a reason, and
Yeah.
all you gotta do is do mole plate testing. And it proves they're sick, or put a urine mycotoxin on the one that's not sick, and they'll be positive.
Right.
And
Yeah.
and, and they usually start getting busy because they read about what mycotoxins do to you, and so then they'll sort of change what they're doing if
Well,
they have too much brain damage.
right. I can tell you, I specialize in healthy homes in my
Yeah.
real estate business. And, my story is I had breast implant illness. I had black mold in one of my implants. When they removed it, it ruptured. So who knows how long I had black mold circulating through my body. So as you can imagine, I did probably for 2 years multiple mold protocols and mycotoxin and heavy metal protocols to rid myself of that. It's still a thing today because I'm very allergic to it. So I can tell you if someone has no idea about mold and then here you come, someone who's super sensitive to mold and has experienced sickness, they don't understand it. They just don't get it because their cognition isn't there. When you have someone like myself, who I don't really feel like you ever truly heal from it, you're because I'm walking into environments all the time that have mold in them. So how does one combat that? Are there binders they should take just to help kind of make their immune system not as reactive? Or is it just a thing where you deal with it?
Yeah, just gotta get out of the environment.
Yep.
Uh, and you can't work or live in a place that's moldy and take mold medicine and rinse your nose out and be okay
Right.
because you're breathing 3,000 gallons an hour a day, and it's just too much volume.
Constant re-exposure could trigger, it doesn't matter where you are and what you do, it's just constant re-exposure.
Yeah. Oh, if you got a home or an office situation where it's full of mold, you're not gonna be doing any work because you're just gonna be sick.
Yeah, and and those symptoms present differently each time, right? I mean, black mold in an apartment building is one thing, but then you've got these other pretty invasive mold spores that cause different reactions. I know for me, and everybody who knows me knows this, I react my sinuses, my ears, my eyes, my skin has rashes. That's how I react. And it's not like a normal skin, my skin doesn't just itch. It's like a weird deep itch because of the mold, right? That's how I know it's mold. I have some rapid fire questions for you, Dr. Dennis, before we wrap up. And I can't wait to hear your answers to these because I feel like the products that you have produced are just so powerful. And like I said, I got a welcome kit that had quite a few products in it, but I can't wait to try some of the other products because now that I know you have the fogger, you have the dishes, I mean, you have all sorts of things that anybody in my business, my real estate business, I can give that to them as a care package for when they close on their home, right?
That's right.
Because these are all very important products to have, whether you're a first time home buyer or you're renovating your home. You will have use for this regardless. It doesn't matter if you're, renting or otherwise. You can have use for it.
You can give all your clients mold plates, and they can canvas places to see if they want to look at them by just going in and do tap test. Really quick, and then, in all the rooms, it's yes, no, and they'll know in 4 days. No, that was the goal. We're not doing that one. And
I'm
so
gonna
they won't.
I can't wait to order. I'm gonna order so many of these products. I can't wait because even where I live right now, I am the cleanest person. My environment's super clean, but I know it could be in the dishwasher, it could be in the washing machine, it could
That's
be
right.
anywhere that's hidden. And I was told, and you can confirm this, that the one place that has the most opportunity for mold in your house. Most people think it's the HVAC or the washer and dry the washer or the dishwasher. It's actually the drain line for your refrigerator's ice maker.
That's right. All that stuff.
That's
It's,
that
it's like a checklist.
and you're drinking it and you're the ice and you're just like, "Wait, you're just ingesting all of that every time you go to get some water or get the ice out of your." That statistic threw me off because I thought,
I would,
"Whoa."
I would say what I do about water, I get uh, bottled water in glass bottles,
Yeah.
and as it's cut, it came out of the ground, nobody touched it, and I don't have to worry about water.
Yeah.
That's
Water's not
easy.
Water's so underrated and it's so important. Okay, I've got some rapid fire questions for you. Bleach or vinegar?
Uh, Bleach doesn't kill it. Vinegar is probably a better cleaning agent.
Okay. Are new homes mold free? I know the answer to that.
No.
Nope, they're not. Worst room for hidden mold?
Probably the laundry room or the shower.
Mhm. I think I know the answer to this. The best mold tests.
Environmental, I think the mold plates are.
Yeah, I
Ver-
agree.
Versus all the others out there. Now, there's nothing wrong with the other testing that's really expensive, but the numbers they consider to be safe are wrong.
Yeah,
They're too high.
yeah,
So you can spend a lot of money, a couple of $1,000 to check all this real estate, and it'll come back. It's fine, and it's not fine for somebody like you, myself. We
yeah,
couldn't live there.
yeah,
So you gotta take the number and almost cut it in half, or at least a third, and then that's where you need to be
yeah.
if they say it's normal.
Right, exactly.
you know.
If it stays normal. What's the biggest dietary source of mycotoxins? I know this one.
Coffee is one.
Yeah. Yeah, peanut butter.
Oh, yeah, peanut
Yeah,
butter. Yeah, it
forget
it
it.
tastes it tastes great while you're poisoning yourself, you know?
Yeah, that's it. Every bite you take, that's just one teaspoonful of mycotoxins.
That's
That is one
right.
of the biggest. There's
That's
so much mold in
aspergillus
peanuts.
too. That's
Yeah,
aspergillus too.
yeah, yeah, and that's one of the worst ones. Can genetics increase mold sensitivity?
Oh, yeah.
Yeah,
You can have different genetic predispositions, so you can't dump the toxin. That's a
yeah,
genetic problem, and
yeah.
so those people really get sick. That
Mm,
and then take a long time to detox. Now, oxygen, 100% oxygen for 2 hours a day in those people, provided they don't have lung disease, really gets it out of the brain. Nothing else works better than that, then along with the other products. But if you have a real serious cognition issue after mold exposure, you gotta have oxygen to get rid of it.
what is the biggest sign that that mold is affecting the brain?
The patient knows that cognition is,
Yeah,
below a 10,
yeah,
that they know. They know before the and then the family knows before they know.
yeah. So how long until the brain fog improves?
It can be instantly. It depends on how long they've been in it and how much is in their brain.
Yeah,
But if you start them on the all the nasal treatment and the environmental treatment at the same time, usually they get better within a week or so. If
yeah.
they don't, something either they are not out of it or they've got it in their sinuses and it's reinfecting them after the wash. So inside the sinuses, you can't reach with a nasal lavage.
Yeah.
You have to, if they haven't had surgery before, you have to open them to clean it out.
Mm.
And that's a large group of people. They kind of know who they are because they've done everything correctly. They're in a safe place. They're washed now. They got a mental, brain score of 5, energy level 5. Most of those people need surgery.
Wow. So what's one daily sinus health habit?
Irrigation with saline.
Yeah. That's underrated, but so effective. I think
Oh,
people take it for granted.
it's very effective.
Mhm.
It works better than anything on the planet just to get it out of your nose. It always comes in through your nose, so you got to clean it out.
So what are your thoughts on ozone insufflation, both ear and sinus, for any sort of like killing off mold colonies that could be in the sinus area?
Um, I'm not a proponent of that. Now, there's nothing wrong with ozone in terms of, yes, it kills mold in the ears and in the nose. No question about that. But ozone knocks off your cilia. So then you can't transport your mucus correctly because you
Mm,
knocked off your cilia. So I don't think it should be used as in the nose.
yeah.
I think a better treatment is just irrigation with an antifungal works better than ozone and is safer because you
Yeah.
don't knock the cilia off and you're not killing all the friendly bacteria.
Right.
See, ozone kills everything.
And yeah, it's pretty potent. Yeah.
So
So
you don't need to do that.
yeah. What about like a nasal spray by B propolis? Have you heard of that?
Yeah, B propolis, that's okay, that's safe,
Yeah. Yeah.
but also you don't wanna just rely on that. You wanna
Yeah.
irrigate your nose out first and sort of wade into it a little bit. I still use, the citrus spray. If you wanna use B propolis, do it, but I don't think that by itself is an answer.
Yeah. Okay. So, Dr. Dennis, if somebody wants to work with you or learn more about your products and your company, how do they reach out to you?
Uh, just call the microbalance number. That there's plenty of help on the line for all the details you would have
Okay.
at home.
And if there, what's your favorite product in your product line? Which one?
That's hard. I can't we ain't I like citrus spray because it took me 20 years to make it, you know.
Yeah. Yeah.
Citrus spray is got all the antibodies to all the fungi and bacteria.
That's
I
just that's the room spray.
spray it under your tongue, and then if you have a sore throat, you spray your throat, and it gets rid of the sore throat immediately.
I'm gonna
That
have
was
to look at
citrus
that too.
drops. Citrus drops, you can put 3 or 4 drops in 3 ounces of water. Like if you've got a sore throat, you gargle with it, for a few seconds and swallow it, and then drink some water behind it. Also, if you've been to a restaurant or something and you've eaten something that you think, okay, that wasn't very good. I think there's something wrong with that. just immediately take about 8 drops in 3 ounces of water, 6 drops, sh shoot it down, then drink water behind it. You will obliterate anything you've ingested. It will kill anything.
And all of
So,
this is available on your website?
yeah, and it's inexpensive, and it's
Okay.
not a prescription. So, it's very few things that if you ate some bad food, you can
Yep.
do something right away to stop from getting sick.
Yeah. Okay. So on Instagram, your microbalance health. What's your website?
Microbalance Health,
.com.
yeah.
Okay. So you guys, if you are in search of a natural and holistic approach to mold exposure sicknesses, whether it's environmental or you're truly feeling sick, Microbalance Health is absolutely a company that you should look at. I have some of their products. I am going to look at more of their products. I can tell you my experience immediately has been a very positive one with this. And I am a chronic mold exposure person because of all the homes that I go into that have mold into them and some of the foods that I eat. So I know firsthand when a product is truly an effective product, and their products, Microbalance Health on Instagram, are absolutely worth the investment. So if there's a starter package, is there something that you would recommend, Dr. Dennis, as a starter package, or is it a la carte?
I would say a starter package, environmental starter package, and then a patient body, package.
Yeah.
I would start with those. That's the
Okay.
easiest way to do it
Okay.
'cause it's got a little group of things that by them when you use them together, you get a huge result, and it's
Perfect.
not
Okay.
that expensive either.
If you have any other questions, reach out to me. I'll connect you with Microbalance Health. They are absolutely worth every bit the hype. Dr. Dennis, thank you for taking the time. I appreciate it. I know it's 3 hours ahead for you. So thank you so much for your knowledge. Thank you for starting this company. I look forward to learning more about it as the days go. And I look forward to using your products even more so and and referring my products to all of my customers who buy a home because anybody can benefit from this. So Dr. Dennis, thank you so much for your time and for your wisdom and for just all that you do.
Thank you very much. Enjoyed it.
Thank you, Dr. Dennis. We'll see you soon.